Hello friends, I'm Dr. Avinash Agrawal. I'm an exclusive hair transplant surgeon for over 15 years with an experience of 4,500 surgeries done all over India. I'm associated with AQ Aesthetics Hair Centers at Villeparle and Hair Restore Clinic in Bandra. Today we are going to talk about a molecule called as Redensyl. Can Redensyl be replaced with minoxidil? Let's answer these questions for you. Redensyl is a plant-based molecule. These are molecules derived from the excessive use of plant extracts and also the combination of multiple such products. So when you make a combination with something called as dihydrocosytine glycoside, which is one of the molecules, a second is an EGG glycoside, a use of glycine, and something which is more important is zinc. So these four major ingredients form Redensyl. So Redensyl being a plant derivative, it is very organic. It can be easily applied on the entire scalp skin. It increases the cell cycle and hence these follicles can become thicker, fuller. And when the cell cycle is increased, the multiplication of the cells are increased, the thicker follicles can produce a thicker looking hair. That is what is the main purpose of Redensyl. When the hair is thick and full, they look more voluminous. Post any surgical process which is there on the scalp. So 15 days later is what I recommend that one should start using Redensyl every day at least once as an application. You can make it twice after 15 days later so that the action of Redensyl is not just anti-inflammatory but it increases its action to make the follicles more thicker. Now here we are looking at a combination of the transplanted hair to grow together along with your existing hair as well. And hence Redensyl is definitely a most important molecule that can be added post hair transplant. Redensyl is a very good molecule that can increase the volume of the hair and at the same time control the hair loss, because as an anti-inflammatory agent, it can actually reduce the alopecia or the hair loss condition so that they are not advanced to further stages. Now, as we're comparing it with minoxidil as its own agent, it's nothing but a vasodilator. It can increase the thickness of the blood vessels in the scalp skin and hence provide the right nutrition which is carried by that blood into the scalp skin. But comparing it with Redensyl, I think they both have different ways to act with each other. But at the same time, because Redensyl has its own properties, it can not just increase the thickness of the cells because it is providing the right amino acids, that is the keratin molecule which is glycine, and that gets converted into keratin, and hence keratin is the building block for the hair. So the hair volume, thickness, fullness is all what you can add as a molecule. So a combination molecule is what is Redensyl. So Redensyl can work in all the stages. But of course, what kind of action will produce what kind of results? So when we start saying that, okay, fine, can I replace this with hair transplant? Probably a little difficult. Can I make something beyond as a result with it, where you can have a fuller head of hair within few months? It's a little difficult because remember, if you can achieve anything which is up to 30 to 40% in the hair volume, hair thickness, hair quality, it is a result achieved. And for which they need to understand that whatever volume that they've lost, they can regain about 30 to 40% of that volume with the thickness and the quality of the hair. But if the scalp has gaps and spaces and see-through, then the follicles are just not developing by themselves and they're completely regressed and they are now gone, those follicular spaces need to be filled with nothing but a hair transplant. So where there is no scope of hair growth, it's not where you have to keep on applying a medication and expect that the results will start giving you a fuller head without just having to transplant or maybe cover those little zones. So in my books, I have always said that you have to space out your molecules, choose the right molecules for the right person so that you can know somebody who's in stage 2 with a hairline fall and a temple loss. You can start choosing with Redensyl as the first molecule. Of course, they say that within a month or two, my hair fall is increased, enhanced, but it's still not getting control. Maybe you can add minoxidil in the nighttime as an application, or at the same time, you can add some peptides to make the hair quality thicker and better. So what you need to do is you apply Redensyl in the morning and maybe minoxidil at night. This is what is my regular recommendation. Hair loss per se is not just what you're treating from outside. it is from what you do from inside. What goes inside also produces hair. So I would tell patients to go for the right nutritional therapy. I prefer to mostly give them something called a cyclical therapy, where they're taking low dose nutrition at different intervals so that no repetition of the medicine is there, but at the same time the enhancement of absorption in the gut is much stronger for those medicines which are taken at intervals. And once the nutrition for the hair is enhanced enough by maybe dietary changes, as we know that of course they can add amla in their regular diet. Vitamin C is important. You can add almonds, you can add walnuts, you can add a lot of 7 seeds, what is well known today's times. Of course, when you start applying onto the scalp skin, you need to of course see that the scalp is cleansed enough. I've seen people who don't even wash their scalp for a week. Women, I would really request you, please wash minimum 2 times, maybe up to 4 times also if you can, so that the scalp skin is more receptile, available for absorption of any nutrients that you're putting onto the scalp skin. So sometimes the scalp has other problems like dandruff, psoriasis, eczema, and these skin changes probably reduce the absorption of any nutrients or any applications on the scalp, because the turnover of the cells in the scalp is so high that all the absorption is done in the superficial layers, but they are completely washed off at every time. So you need to first treat that on a major basis, for which there are multiple therapies available, applications available, therapies which are of course available in the clinics also, and you can add the scalp quality getting better so that the enhancement of the product which is penetrating the scalp skin is also increased. So certain therapies on the scalp that will enhance the penetrability of the products, which could include some jet sprays, removing the dead debris of the scalp. We also perform something called a scalp analysis along with scalp peels. This can remove the superficial layers of the scalp and make the scalp more perceptible. To add on, of course, who doesn't know about mesotherapies or microneedles? So mesotherapy is the major way to actually penetrate the scalp into the superficial layers of the skin and hence let it go deeper superficially later, so that the enhancement of the product is more better. Now when the product is applied, you can use like microneedles of about 1.5 mm in depth, or you can also use derma rollers, which is very easy and home-based application that can be applied to it. So most therapies which include scalp peels, scalp cleaning with jet sprays and peels, and also scalp microneedling and mesotherapies. Thanks for watching Dermis with Dermats. We'll be back again with more videos for skincare and hair care. If you have any queries regarding Redensyl as hair care, do type in your questions in the comment section below.